Hi everyone! Today we will learn how to diagnose gestational diabetes. Let's start by imagining a clinical scenario. A 34-year-old woman is coming to her prenatal care appointment at 26 weeks gestation. She reports she has been feeling well and her pregnancy has moved along with no issues. And she's bringing lab test results from her last consultation. Of particular interest is to look at her oral glucose tolerance test, or OGTT. In pregnant women, this test is indicated between the 24 and 28 weeks of gestation to screen for gestational diabetes. Currently, there are two recommendations to interpret OGTT results. One recommendation is to conduct the test by administering a 75 grams oral glucose solution and then measuring the plasma glucose level at 1 and 2 hours. This is known as the one-step approach for diagnosis gestational diabetes. Diagnostic criteria for this approach are shown on the screen. The other recommendation is called the two-step approach and is mostly used in the US. This approach is based on first screening all pregnant women by administering a 50 grams oral glucose solution and then measuring the plasma glucose level after 1 hour. Women whose glucose level exceed 130 to 140 milligrams over deciliter on that first test then undergo a diagnostic 3-hour 100 grams OGTT. In the screen, you can see the diagnostic values when using this approach. Keep in mind that there's still no clear evidence of which approach is better, so institutions might choose to use one approach over the other. For our patient, we will use the one-step approach. In our patient, we can see that her fasting glucose level is at 85 milligrams over deciliter, which is fine. But then, her 1-hour glucose level is at 165 milligrams over deciliter, which confirms the gestational diabetes diagnosis according to the values that we showed you before. Proper management will reduce our patient risk of maternal and fetal complication. Usually, gestational diabetes treatment starts with non-pharmacological therapies such as dietary modification, frequent exercise, and glucose monitoring. I hope you have learned something new today, and remember to share this video with your friends. See you next time!